Good afternoon, everyone. I am Yasushi Sakuramoto, and I am the public official from the Ministry of Health in Japan. So it is my great pleasure today to show you the Japanese health system. I would like to talk about this, how Japan achieved living the longest and the healthiest. First, I will give you an outline of Japanese situation, and then I will explain the contributors to increase the life expectancy in Japan, and then I will focus on the most important point. So let us start by reviewing Japan. So where is Japan? Japan is here near China or Korea, and this is the United States, Africa. Japan is a very, very small island, and the general information is population is very crowded population 127 million, and the life expectancy reached 83.4, which is ranked top in the world, and high aging rate. Aging rate means the percentage of over 65 years old people per total population is 24.1%, and it would reach 30% in 2025, and in rural area it would 40% in 2025. So it is very, very aging society in Japan. And doctor and nurse health facilities, and total health expenditure is about 390 billion US dollars. So please see this picture. This picture shows Japanese women. She is Miss Gin, and she is Miss King. In English, she is Miss Silver, and she is Miss Gold. And they were very famous. They are very famous in Japan because they were twins and 100 years old. Well, so they are very popular in Japan. However, nowadays, it's not really unusual for Japanese people to live over 90 years old or even over 100 people. Let's see this life expectancy graph. This is a life expectancy comparing to OECD countries. So Japan is ranked first at 83.4, and OECD average is 80.5, and the United States is here. 98.8. So someone might think the difference is only 3 years or 4 years, so it is very tiny, so it doesn't matter. But, however, some research indicated that if United States try to increase 3 or 4 life expectancies, it would take 30 years. 30 years. So the difference is very, very huge. On the contrary, this graph shows the current expenditure on health percent of GDP. So the Japan is here, 9.5%, same to OECD, and the United States is here, and other developed countries here. So it indicated that the Japanese health expenditure is relatively lower than OECD countries. So looking at this graph, this is a trend in life expectancy at birth from 1900 and 2008. So very big span, very wide span. Generally speaking, all countries had increased like that, and Japan is red color here, this one. This one is red Japanese graph, and let's show this here. This is 1950s, and here is 1960s. The life expectancy in Japan, both male and female, rapidly increased since 1950s. So in 1950s, the life expectancy is one of the lowest country in Japan, but now highest. And 1980s, Japan was ranked top life expectancy in OECD countries. So what happened? What happened in this graph? So before World War II, 1920s, infant mortality rate fell. So this is one of the reasons here. More importantly, after World War II, 1950s, life expectancy unprecedentedly increased. So this increase during the 1950s to 65 accounted for almost 40% of the total increase during 1950 to 2010. So, So this is a big increase 1960s. In 1986, female life expectancy has ranked first. And in comparison, health expenditure per GDP under 8.5%, so relatively lower than other countries. And as a result, male and female life expectancy increased approximately 30 years from 1950 to 2013. So why? Why is Japanese life expectancy so high? So according to previous researches, there are many complicated factors to contribute to increased longevity. As far as I know, it included, for example, food, culture, or genetic factor, or community. But today, I would like to clarify it in terms of public administration, public policy, based on the research published in 2011 in Lancet paper. So, it is believed that there are three possible contributors to increase longevity in Japan. First is equal opportunities for health promotion. And second is the government's strong intervention. And third is stroke mortality reduction after the mid-1960s. So I'm going to describe in detail according to these three characteristics. So first of all, and most importantly, equal opportunities for health promotion. Before World War II, Japan started compulsory primary education for everyone. So it contributed to increase literacy of mothers in the early 20th century, and which contributed to infant mortality rate fell. And next, here, universal health insurance coverage. So universal health insurance coverage started in 1961 after World War II. And it achieved high accessibility for everyone and everywhere. And last, equity. Equity in human security is core value in Japanese health system. So historically, Japan is a homogeneous and egalitarian society, and there are small disparities in health across regions and socio-economic groups. So what is equity? I think you might have seen this picture in some classes, but this picture shows the difference between the equality and equity. So equality means safe opportunity. Like the safe opportunity, they have each person has same opportunity to catch fruits. But some people can get this one, but some people doesn't. But equity means same result or same outcome. And by filling the gaps, like here, this box, among them. So the Japanese health system's concept is based on equity. This is a very important concept. And one research mentioned that countries that have the least regional or socio-economic disparity in longevity tend to be those in which the populations enjoy the longest life expectancies in the world. So that is, the less disparities exist, the more longevity they enjoy. So the second contributor is a government strong intervention. In 1950s and early 1960s, the government aimed to control of intestinal or respiratory infectious diseases or anti-tuberculosis, vaccination policy, and water system and deliberation, which decreased mortality rates for communicable diseases. Communicable diseases means infectious diseases. Infectious diseases in children and young adults during 1950s and 1960s. But at that time, per person GDP was roughly international $3,400 in 1950. So Japan was not a rich country at that time. But the Japan prioritized to pay the budget to control public health issues at that time. So as a result, probability of death before the age of 5 years decreased dramatically. So from greater than 80 points per 1,000 live births to by 1965 about 20 per 1,000 live births. It accounted for 4.1 years increase of life expectancy in male and female life expectancy at birth of 4.3 years increased. And for young adults, 95% reduction in the number of deaths from tuberculosis in adults in 1950s to 65. And it contributed to the increase in life expectancy of 2.4 years in men and 2.3 years in women. So that's, this government intervention contributes to this rapid increase in 1960s. So next is the stroke mortality reduction. So stroke means acute brain damage. So technically we say cerebral vascular diseases. And the government aimed to control blood pressure and salt reduction campaigns because Japanese food contains too much salt. So we aimed to reduce the amount of salt. And anti-hypertensive drugs and universal health insurance coverage. This means that everyone can go any hospitals under universal health insurance coverage and could take drugs to reduce the hypertension. So please see this chart. Please see this graph. This shows the cause of death in Japan. So interestingly, Japan has the high mortality in stroke compared to heart diseases. It's different from other countries. So since 1965, the percentage of stroke or mortality of stroke reduced dramatically like that due to the government intervention, stroke mortality reduction. So as I mentioned, some contributors, there are many factors to increase the life expectancy in Japan. But what is the most important? What is the most important factor? So we believe that it is universal health coverage. Universal health coverage will the most important factor to increase the life expectancy in Japan. So now, let me explain Japanese universal health coverage system. So the definition of universal health coverage is here, health for all and everywhere. So technically, to ensure that everyone everywhere can access quality health services without facing financial hardship by health insurance or tax as a dispersion of risk or wealth distribution. And according to WHO, World Health Organization, there are 3 dimensions toward universal coverage. So first is population, who is covered. And second is services, which services are covered. And third is our direct cost, proportion of the cost covered. So when we talk about universal health coverage, we tend to focus on only population who is covered because it is easy to understand to deal with non-covered people. It's very easy. So the politician says we should achieve the 100% cover, but only population who is covered does not make sense because if other factors such as the services or cost is not meet the goals, the universal health coverage doesn't work very well. For example, this case, I have an insurance, but the co-payment is very high. So I do not afford to go to the hospital. So it is one example, and other example is I have an insurance, and the co-payment is free, no free, but service is limited, so I couldn't recover. So that is a very typical cases in many countries. So we should focus on these three factors simultaneously. Who is covered and which service should be covered and how much of the cost should be covered. So who is covered in Japan? Japan covers 100% people, 100% coverage by medical insurance of public unions and public assistance. And insurer is 100% of public unions, not private unions. It is very important because, let's see this one, why the social insurance system is the basis. This means the social insurance system based on the premium of the population. The public subsidy, the public tax is put as a resource to maintain the universal health insurance. This is a very important factors to maintain financial issues in the Japanese health insurance system. So second, which services should be covered? So Japan has very unique system. We have a free access system, which means patients can go any hospital and clinic where they would like to go without appointment or without reference. So if I would like to go to the University of Tokyo Hospital, I can go today without appointment or without reference. So this means free access. And simultaneously, doctors have a duty to treat patients in law, Medical Practitioner Act. So they cannot decline to see patient without legitimate reasons. They have to see the patient under the law. So I'm a doctor, so when the patient come here in midnight, I have to see the patient technically. And the third factor is government determined the coverage of services. So technically, patients can take common service in anywhere, any hospitals. And the last element is how much of the cost should be covered. Co-payment is from 10% to 30%. And 13% on average. You might think this is not affordable, this is very high compared to other countries. But important factor is here, co-payment ceiling system. So co-payment ceiling approximately 300 to 1,300 US dollar per month according to age and income. So this means even if co-payment reach 10,000 US dollars, they need to pay only this one. This is a very big system in Japan. And more importantly, publicly centralized reimbursement price, which means that government determined all medical fees. So that we have common fee schedules, which means same price in any hospital and any clinics. And we also conducted price ceiling in total budget to reduce total medical expenditure in price ceiling. So some of who studied microeconomics you might say that price ceiling is inefficient, but as I mentioned, the Japanese concept is focused on equity. This is very important. But I will mention that inefficiency is a big problem in Japan. So this is in detail of co-payment for medical expenditure. This is very detailed, so I skip this one. And this is a high-cost medical treatment system. This line shows medical expense 100% like that. And this is co-payment, typically 30% like that. So if medical expenses is $10,000, the co-payment is $3,000. But if the co-payment reaches some point here, the co-payment will increase like that very stably, like that. So, for example, the treatment for cancer or surgery for cardiovascular is afforded for everyone. So to wrap up, meaning of the universal health insurance system in Japan. Japan has realized the world's highest level of life expectancy and healthcare standard through the universal health insurance system. And characteristic includes covering all citizens through public health insurance and free access, freedom of choice of medical institution, and high-quality medical services with low cost because government determines all medical fees. And while the social insurance system is the basis, the public subsidy is put as a resource to maintain the universal health insurance. So look at this circle. This is a proportion of the burden of national medical expenses in Japan. So insurance premium is almost half, and the patient payment, so co-payment is about 12%, and the rest is covered by public subsidy, by local government and state subsidy. So the challenges. Facing challenges in Japan. As I mentioned, Japan achieves the longest life expectancy, but we are facing challenges include many things. The most important challenge is financial sustainability. And because of free access, there are many patients. There are many patients in hospital and outpatient, so exhaust medical staff. So when I worked as a practitioner in the Japanese hospital, so I worked continuously 50 hours is very normal because I have to work in daytime and midnight and next daytime. So it's very, very tough task for medical staff in Japan. And inequality in geographical or insurance inequality and the skewed distribution of physician specialty. This means that doctors can choose any specialties they would like to. So the doctors tend to become, for example, internal medicine or surgery, no, it's not surgery, internal medicine or the specialty which is easy to work or something like that. So they tend to avoid the heavy work such as surgery or pediatrics, something like that. And discrepancy between demand of patient and supply of doctor. So recently, the demand of patient would increases very well. So the doctor need to not only the technique, but also attitude or something like that. And nowadays, the Japan's problem is non-communicable disease, non-infectious disease, such as tobacco smoking, high blood pressure, and several cardiovascular risks. And the number of suicide is much higher than other countries. Maybe stressful world in Japan, and so on. And among them, I would like to focus on financial sustainability today. So this is the demographic changes in Japan. The bar shows the total population, So here is, this is a 2012 and 2015. This population would decrease to 2055 because total fatality rate is 1.41, so under 2, so the population will decrease. In comparison, this is the aging rate, aging population. So you can clear, this graph clearly shows aging population would increase rapidly like that. So in 2060s, aging population rate would reach about 40%. So this is one of the very big programs in Japan. And trends in healthcare expenditure. So due to the aging society, the demand of health would increase rapidly too. And the productivity population, the number of productivity population would decrease, so the tax revenue would decrease. However, the healthcare expenditure will increase rapidly like that. So it is true that in 2008 or 2007, the national health expenditure as a percentage of GDP, is not so high here, but nowadays it reached over 10%. So the expenditure would increase rapidly. And this is an index transition by items in general expenditure. Compared to education, defense, public project, social security expenditure increased rapidly like that. So this is a very big problem. So our challenge is, who can pay here? Who can support here? This is a very big problem. So the strategy first, raising consumption tax. This is a political decision. So in Japan, we have a 5% consumption tax before 2014, but in 2014, we raised 3%. And in 2017, the politicians intend to increase it to 10%. And the politicians said the revenue of the raising consumption tax paid for social security expenditure to make consensus. And the promotion of generics. Generics means new medicine, cheaper medicine. So for example, cheaper medicine. So for example, the patent of some medicine terminate. After termination of some patent, other companies make cheaper drugs. It is called generics. So target is 70% in 2017 and 80% on volume between 2018 and 2020. And comprehensive measures including incentives in medical fees system. And insurance reform, integrating risk pooling function municipalities to prefecture levels. And strategy 2, healthcare reform, promoting of functional differentiation to achieve the efficiency. So divided to acute recovery chronic phases. This is because in Japan, there are many hospitals, but all hospitals include these all functions, acute recovery chronic phases. It is inefficient, so we need to promoting of functional differentiation and promoting whole medical care and primary care and general medicine. So the number of primary care is fewer in Japan than other countries. So standardized specialties through professional autonomy and establish general medicine to achieve a primary care, and for the functional differentiation between large hospitals and clinics, raising the fee for the first visit to large hospital without referral. So that is associated with free access. And preventive medicine, 10-year plan stipulated in Health Promotion Act and the cancer screening, health promotion guidance, or minimally invasive treatment, short stay in hospital. And strategy 3, innovation, health technology assessment, harmonization of pharmaceutical regulation, and information technology, ICT, electrical health record, health promotion with incentive using research data and local ICT network among healthcare facilities from pharmacies. So that all strategy means expect this one. We need to focus on efficiency in addition to equity now. So this is our phrase, Japanese challenge phrase. So global lessons, 3 lessons. So strong intervention. As I mentioned, even in 1950s, Japan was not a rich country, but Japan had a very strong intervention, and consequently, the Japanese life expectancy increased very well. So countries with low socio-economic development can achieve progress through strong intervention by government. And the universal health coverage, the path toward universal health coverage should be encouraged globally. And equity, the goal of a health system includes not only improvement of the average, the goal of a health system includes not only improvement of the average, but also reduction of health inequality to a minimum. No, this is today's global lesson. Thank you very much for your attention.